Hi, my name is Kapwi, also known as Dr. Atta Jr. I'm a general practitioner. I studied at the University of Witwatersrand and I've been practicing for 5 years now. I'm very passionate about women's health, and today we'll be doing a series of videos on vaginal discharge. I said it wrong. Because it's something that I've seen is quite common and can cause some confusion, so just to talk about it so we remove the shame. You get a physiological and an infectious discharge. With the physiological, it's not something that you should be worried about. It's usually not caused by anything infectious, it's caused by a change in hormones. So with the natural woman's cycle, you get a surge in different hormones which can cause an increase in your discharge. Usually around the time when you ovulate, for the vagina to prepare for fertilization, for making a baby, the discharge has to change. So usually around day 14 for most people, day 14 before you have your period, not day 14 from the last period, your discharge will increase in amount and also stickiness. It's very natural, it's very normal. Some people find that disturbing, but it's a natural discharge to have. Usually is odorless and is clear. Some people have a bit of a tinge of white. The other types of discharge that are physiological would be if you're pregnant. Usually you'd get a whitish, thin discharge that is also normal. And as you approach menopause, your discharge also changes. The most common discharge that is infectious but is not an STI is thrush, or also known as Candida. It's something that is very, very common, and it happens when there's a change in your pH. If there's a change in your pH in your vagina, your discharge can change because there is naturally occurring bacteria that grows there. And when this changes, when the pH changes, there's an overgrowth of that bacteria. And the specific bacteria we're talking about right now is Candida Albicans. So it's a yeast, and what it does is it starts to grow and it causes a lot of discomfort. It can cause itchiness and it can cause you to get a thick cream cheese-like discharge. For some people it's a bit yellow, but the main thing is it looks very thick, like cottage cheese. This change in pH can be caused by anything, literally from wearing panty liners for very long, or pads that you don't normally use, from wearing tight pants to a change in your diet or increased stress levels. This can happen. So it's nothing to be ashamed of. It's not something to worry about like, oh my goodness, I have an infection. No, it is very normal. Certain people have it more than others. So if you are pregnant, because your immune system is a bit lower during that time, you can get it more regularly. Also, if you're diabetic or have any immunocompromised state, that can predispose you to getting it more frequently. So how it's treated usually is with vaginal pessaries, which are tablets that you put inside the vagina, or creams that you can put inside the vagina just to get rid of the yeast. There are also natural ways of treating yeast, but that now goes into Mythbusters. So the general thought is that if you put yogurt inside your vagina, you can treat the yeast infection. Please do not do this. You're not meant to put the yogurt inside the vagina. You can increase your consumption of the yogurt because it contains something called probiotics. Probiotics are basically another type of bacteria. that help your body to fight off the yeast. And what this does is it stops the infection from growing, but it doesn't kill it off. But your body, because the vagina is self-cleaning, will naturally flush it out after some time. The other myth buster is pineapples, yes. So there's a belief that if you eat a lot of pineapples, your vagina cleans itself. Well, it increases the way your vagina cleans, and some people say that the smell of the vagina also becomes like a pineapple, and that is false. Your vagina is self-cleaning, whether or not you eat pineapples or not. It'll still clean itself. It smells how it smells, dependent on the different pH levels and what bacteria is growing in your vagina at that time. But I mean, pineapples are good. It won't do any harm to you, but it does not increase your vagina cleaning itself. The last myth buster is steaming. So steaming is something that's very popular right now. There's a lot of products on sale about how steaming cleans the vagina and also tightens the vagina. But I would not encourage steaming because, as I said again, it causes a change in the pH level of the vagina and can predispose you to getting thrush. So depending on what's in the herbs and whatever else is inside the mixture that is used to steam, that can kill off some of the naturally occurring bacteria that usually fights the yeast, and then you get an overgrowth of yeast. Thank you for watching. I hope you found that very informative. If you do have a discharge that you're concerned about, I'd encourage you to consult your doctor, not to self-treat it at home. And if you would like to hear more, I do have another video coming up on the different types of infectious causes of vaginal discharge. You can follow me if you'd like to know more about me on Instagram at Kafata, would be in the handle. The handle will be in the link. Bye! So, it's not okay to use soap inside the vagina. I know a lot of people feel that that's how you get clean, but because our soaps are quite harsh, they clear off most of the protective bacteria that grows in the vagina, and that could result in you having an overgrowth in yeast. So that's a big no-no, using soap in the vagina. Also douching. Douching is basically, it's like using soap inside the vagina, but there's different douching products that you find on the market. Some are tailored to be the correct pH and not cause a shift in your vaginal pH and actually support the pH of the vagina. So they're tailored to not cause yeast infections, but to be on the safer side, it's always best not to use any products inside the vagina.